यहाँ की अपार संभावनाएं को यहाँ के दो दलों ने बारी बारी से सत्ता देकर केवल विश्वासपोषक किया है, केरल के विकास के दौर में इसको पीछे रखने का काम किया।
ഇൻഫൻറ്റ് മോർട്ടാലിറ്റി റേറ്റ് കേരളത്തിൽ ഏറ്റവും കമ്മിയാണ്, നല്ലതാണ്. പക്ഷെ അതിൻ്റെ അണ്ടർലൈൻ ഫാക്ടർ ഒന്നും നമ്മൾ മനസ്സിലാക്കിയിട്ടുണ്ടോ? അപ്പോൾ ഇത് അല്ല, ഒരു ഔട്ട് ഓഫ് കോണ്ടെക്സ്റ്റ് ഇൻഡെക്സ് എടുത്തിട്ട് നമ്മൾ അസസ് ചെയ്യുന്നത് കറക്റ്റ് അല്ല.
In politics, sharp rhetoric is normal. Parties in opposition are expected to criticize governments. But in Kerala, for years now, something more has been happening.
Instead of limiting criticism to policies or decisions, several BJP leaders, from national figures to state-level campaigners, have repeatedly questioned the state's overall development itself, that too for decades.
It's not that this government failed or that government didn't perform well, but Kerala has failed as a narrative. So how do these claims hold up against facts? We take a closer look.
ഏറ്റവും കൂടുതൽ യൂത്ത് മൈഗ്രേഷൻ കേരളത്തിൽ നിന്നാണ്. അപ്പോൾ യൂത്ത് അല്ലേ കുട്ടികളുണ്ടാക്കുന്നത്? അപ്പോൾ കുട്ടികളുണ്ടാക്കുന്ന യൂത്ത് ഇവിടുന്ന് മൈഗ്രേറ്റ് ചെയ്യുകയാണെങ്കിൽ പിന്നെ ഇൻഫൻറ്റ് മോർട്ടാലിറ്റി കമ്മിയാവില്ലേ?
IMR is a rate, not a raw number. It measures infant deaths per 1,000 live births. So even if fewer babies are born, that alone does not bring the rate down. Migration can affect how many children are born. It does not determine whether infants survive. Survival depends on healthcare, nutrition, and living conditions.
If migration were the reason, high migration states like Bihar and Uttar Pradesh would also have low IMR. They do not.
Kerala's IMR is about 5 per 1,000 births, compared to roughly 25 nationally. That gap exists because of strong public health care, high institutional deliveries, high female literacy, and long-term investment in maternal care and sanitation. Now, Rajeev Chandrasekhar had also criticized that 92.5% of Kerala's revenue goes into debt, interest, salaries, leaving almost nothing for development. That number is high, but the conclusion is misleading.
Many Indian states spend a large share of revenue on committed expenses. Punjab around 85 to 90%, Tamil Nadu 70 to 80%, Uttar Pradesh around 70%. Kerala is on the higher side, but it is not an outlier.
More importantly, this spending is not dead weight. It pays for teachers, nurses, and public systems in health and education. This is exactly why outcomes remain strong. When debt is largely used to build robust public systems, it's not a waste of money, but an investment in better lives for citizens.
Next, during a campaign in Kollam in the last week of March, Nitin Nabin said Kerala's development had been stalled for 70 years.
That claim collapses the moment you look at the data. Kerala ranks number 1 in India on Human Development Index. Literacy is around 95%, infant mortality is among the lowest, life expectancy is higher than the national average. These are not recent spikes, they are a result of steady gains over decades. Kerala's model in public health and education is studied globally. Calling this stalled ignores measurable reality. Kerala ranking highest in HDI shows that it is far from stagnant. Multidimensional poverty is below 1%, among the lowest in India, and per capita income has also grown significantly over the last decade.
This is not stagnation. This is a state that started ahead and has kept improving.
On October 4, 2017, during BJP's Jana Raksha Yatra in Kerala, Chief Minister of Uttar Pradesh, Yogi Adityanath, said Kerala government should learn from Uttar Pradesh how to run hospitals.
He has made similar claims many times and has also claimed that disease outbreaks like dengue showed poor healthcare management in Kerala. But this doesn't hold up.
On almost every major health indicator, Kerala ranks number 1 in India. Uttar Pradesh ranks near the bottom. Kerala has consistently led India in health indicators. Meanwhile, Uttar Pradesh IMR is around 4 to 5 times higher than that of Kerala. And data shows that it has lower access to public healthcare services in contrast to Kerala's near universal institutional deliveries and strong public health infrastructure. Even during COVID-19, Kerala was widely noted for early detection and testing and strong public health response systems. So the claim doesn't hold up at all. Kerala's healthcare system isn't perfect, but by most measurable indicators, it remains one of the strongest in India. It's definitely not a weak model. And I'm sure you remember Prime Minister Modi's Somalia remark.
केरल की जनजातीय जनता शेड्यूल ट्राइब उसमें जो चाइल्ड डेथ रेशियो है सोमालिया से भी स्थिति खत्म.
The remark drew sharp criticism, and for good reason. As we have established, Kerala's overall IMR at the time was among the lowest in India. Somalia's IMR was among the highest in the world. The comparison relied on a small subgroup and presented it as a broader reality.
And that makes it misleading. Because across healthcare, education, and human development, Kerala's performance is not just accidental, it is the result of sustained public investment over decades.
That does not mean everything is perfect. Issues like unemployment and industrial growth are real. But sweeping claims like failure, stagnation, or no development do not match the evidence.
In the end, the criticism is fair, but misrepresentation is not. And if the goal is to understand Kerala, the data tells a far clearer story than political rhetoric. Here's a quick reminder that for the last 1 month or so, we've had reporters spread across Kerala and Tamil Nadu bringing voices straight from the ground. We spoke to people who matter, voters, on issues that they care about and what they will look at when they go out to vote. We spoke to candidates on what issues they are seeking to get elected on. We also spoke to star candidates and leaders to understand what Kerala elections are all about for them. We have been able to do all this work only because you had our back. So do continue supporting us. You can scan the QR code on your screen and power our election coverage.